Hello everyone, my name is Natalia. I'm going to be doing part 2 of the exam. This is Art of my husband. He is the volunteer for today. And first we're going to start with the cranial nerves exams, and I'm going to explain to you step by step what we're going to do. So the first nerve I'm going to do is nerve number 2, which is the optic nerve. So we're going to look at his pupils. I see that they're round, they're equal. I'm going to flash a light to see if they react. And both eyes, as I'm going right now, constrict, which is normal. I'm going to have you look at the wall, and then you're going to bring your eyes and close them in on my finger. So the same thing for the accommodation part. His eyes went from being dilated to constricted when he had to focus in. Next nerve we're going to do is nerve number 3, which is the ocular motor. Nerve number 4, which is the trochlear, and nerve number 6, which is the abducens. And then this is going to be for the 6 cardinal movements of the eye. So it's going to be, you're going to look at my finger, and wherever I move, you're going to move with it. So we're going to go this way, down, in the center down, to the right, up, and up in the middle. And then that's 3, 4, and 6. Now we're going to do nerve number 5, which is the trigeminal nerve. And what you're going to do is open your jaw for me. And now I'm going to try to push it up, but don't let me. And we have good resistance, so it's a strong strength there. And the next thing I'm going to do is you're going to close your eyes, and I'm going to touch your face. And you're going to tell me if it's sharp, dull, or soft, okay? And only when you feel something.
Sharp. Sharp. Soft. Sharp.
Alrighty, so we see that his sensory nerves are intact. Next nerve is going to be nerve number 7, which is the facial nerve. What you're going to do for me is you're going to open your eyes, now close them, open them again. You're going to lift up your eyebrows, put them down, and now you're going to smile. So we see facial nerve number 7 is working fine. Now we're going to do nerve number 9, and that's the glossopharyngeal. And what you're going to do is just swallow for me. We see the swallow in the neck, so we see that's intact. I mean nerve number 10, which is the vagus nerve. And you're going to say A-E-I-O-U.
A-E-I-O-U.
So we see he can speak, and that's intact. Then what we're going to do is you're just going to say ah for me and stick out your tongue. So we see that the uvula in the back, there's no deviation, it's in the middle, and we see that it rises up when he says ah. The next nerve after that is going to be nerve number 12, which is the hypoglossal. And then that one, what you're going to do is just stick out your tongue for me. There we go, we see that's intact. And then the last nerve we're going to do is nerve number 11, and that's the spinal accessory. What you're going to do is just shrug your shoulders for me. Alrighty. What we're going to do next is just test. What you're going to do is turn sideways for me a little bit. There you go. Okay, and now what we're going to do is test his sternocleidomastoid muscle. So what I'm going to do is you're going to try to turn your face to the right, and I'm going to press resistance, and you're going to go against it, but you're going to try to turn that way. So turn to the right. We see we have good strength. And now we're going to do the opposite way. Go. All right, and we see we have good resistance, so the muscles are intact. Next we're going to check is the bicep reflex. So what we're going to do is have the patient put out their arm, relax it. We're going to go right above, that's where the ligament should be. And what we should see is a little bit of flexion and contraction on the bicep. After that, we're going to do the tricep one. What we're going to do is hold their arm, let them relax it. It swings there, and we go right above the elbows should be the next part. And it should be the same thing, contraction, a little bit of flexion. And then the last one is the knee. You're gonna relax your leg. We go right about there. And it should be the same thing, a little bit of flexion and contraction. Next part, what we're gonna do is check the balance and the posture. So what you're gonna do is stand up for me. And we're gonna move this chair out of the way. You're gonna walk that first forward, and then you'll turn around and walk back towards me. And now stop and turn back. And what we see is that his posture is straight. We see everything's aligned correctly. His gait itself is in the proper, there's no ataxia noted. Next, what we're gonna do is coordination. And what I'm gonna do is you're gonna take your finger, touch your nose, and then touch my finger. So touch your nose first, touch my finger, do it again. The same one, do it again, and do it again. So we see his coordination as well. And then what we're gonna do next thing is you're just gonna lay on the couch for me and we're gonna do coordination with the leg real quick.
I don't know. On the back?
You'll just lay, on your back. Put your feet straight. Down, you're gonna take this foot, put it on your knee, and slide it down your leg. All right, put it down. Pick up this leg, put your heel on your knee, the heel on the knee, all the way up, and slide it down your shin. There we go, and we see the same thing, that the coordination as well. You're gonna sit up, and just like before, we're gonna do, touch your arms and legs. You're gonna have your eyes closed, and you're gonna tell me if it's sharp, if it's dull, or if it's soft. All right, so you're gonna close your eyes.
Sharp. Soft. Dull. Sharp.
All right, so we see that all four extremities, the sensory is intact. What we're gonna do next is the range of motions. So we're gonna start with your neck. What you're gonna do is take your head, put it back, forward. Now you're gonna go from one side of your shoulder to the other side. There you go. And now rotate in the circular motion. Good. Now we're going to do the same thing now with your shoulders. What you're going to do is take your arms and cross them forward for me. You're going to put your arms in the back of you. And then you're going to take your arms and you're going to pick them up, forward, up, and up, all the way up, and all the way down. So we see that your shoulders are intact. What you're going to do is now try to pick up your shoulders. I'm going to see the strength of it against my resistance. So try to pick up as I'm holding down. So we see it's a 5 out of 5, so the strength is intact for the shoulders. Next thing, what we're going to do now is going to be your elbows. So what you're going to do is hold your hands out like this. Try to pick them up like you're flexing them upward. And now what you're going to do is go from side to side. Good. Now what you're going to do is hold them out. You're going to try to curl your hands up as I press down on them. And now put them upward a little bit and press like you're going downward. And I'm going to try to push up. So we see it's a 5 out of 5 for strength for the elbows. Next is your hands. You're going to hold them out straight for me. You're going to point them towards the ground. Point them up to the sky. You're going to go from side to side. And now I'm going to press on them the same way. You're going to try to pick them up. And now flip around and you're going to try to put them down. I'm going to push against it, pick up. So same thing, we have a 5 out of 5 resistance. You're going to stand up. Now we're going to test is your spinal muscle. So what you're going to do is bend backwards a little bit for me as much as you can. Bend forward. Stand up straight. Go from one side. Go sideways. Go to the other side. And now twist in a circular rotation. One way, two way. Thank you. What we're going to do next is going to be your hips. So what you're going to do is lay down for me. Yes, get yourself comfortable. Alrighty, put your feet straight for me. Lift up one leg. Put it down, lift up the other leg. Put it down. After that, what you're going to do is lay on your stomach. Same thing, try to lift up this one leg, the whole leg. There you go, put it down, lift up the other whole leg. Perfect. Now what you're going to do is sit up for me. And what you're going to do is you're going to put your legs together and you're going to try to like lift them up, and I'm going to press it to see for the strength. So try to rise them up. All right, we have a 5 out of 5 strength. Next, what we're going to focus on and start checking on is your knees. Okay, so what you're gonna do now is lay back down one more time. All right, and what you're gonna do is bend your knee and you're gonna try to pull it up to your stomach. There you go, put it down. Do the same with the other leg, thank you. Now you're gonna sit up on the edge one more time. And you're gonna take the leg and pull, flex it forward for me. Good, and do the same with this one. Now we're gonna see the strength of your knees. What we're gonna do is you're gonna try to flex them forward both as I'm holding down. All right, and we see it's a 5 out of 5. What we're gonna focus next is on your ankles. So what you're gonna do is, it might be easier if you just put them on, I think, on the couch to see for everybody. That should be fine. If you wanna, just lay it straight, I think. Okay, so flex them upward, flex them downward, and then go side to side. There you go. Now what you're gonna do is you're gonna try to push upward as I'm pressing down. All right, and we have 5 out of 5 strength. And the same thing, you're gonna try press down, and it's a 5 out of 5 strength over on the ankles from that test. The next thing what I'm gonna do is we're gonna check for scoliosis. So you're gonna sit here. You can turn it that way around. We'll pick up your shirt, and you're gonna lean forward for me. So as we look at it, the spine is straight. I don't see any curvature, so it's normal. And then the last test, what we're gonna be doing is the abdominal test. So I'm gonna have you lay down on the bed one more time, and we'll go from there. So what we're gonna do is pick up the shirt. What we're gonna do first is inspection, look at the abdomen. It's round. We don't see any masses. We don't see any deformities. Look at the skin color. The skin is olive, like the rest of the skin. There's no rash noted. All right. And as we look at it, we also see there's no distension. What we're going to do after this is going to be auscultation after inspection. So we're going to start with the right lower quadrant, and we're going to listen for bowel sounds. We move up to the right upper, to the left upper, and the left lower. And they're normal active one. And what we're gonna do is listen for the bruit, if there is one, with the aorta. And we hear no bruit. After that, what we're gonna do is percussion. So we'll start in the right lower quadrant and make our way up to the right upper. Go on the left side and the left lower. And we hear it's the panic and it's normal. After that, what we are going to do is start palpation. So we'll first start with the light palpation and then we'll go to a deep palpation. Any pain?
No.
And after that, then we're going to go to deep palpation. Any pain?
No.
After that, what we're going to do is try to palpate for the liver. Usually it should be soft. There shouldn't be any bumps and it shouldn't be enlarged. So we'll start down here and make our way up. And take a deep breath for me. And it should be a nice soft. And after that, we're going to go to the spleen, which is on the left upper quadrant. And next, what we're going to do is palpate for the spleen. It's going to be in the left upper quadrant, right under the ribs. You're going to take a deep breath for me. Take a deep breath. And take a deep breath. I don't palpate anything on his abdomen. Sometimes if it's enlarged spleen, you'll feel a bump there. So next what we're going to do is palpate for the kidneys. We're going to do the left side, and we would do the same thing for the right side. So we put one hand under the abdomen, run right above it. We ask the patient to take deep breath in and out, and as they take their breath out is when we palpate to see if we feel anything. Alrighty, so take a deep breath in, out. Take a deep breath in and out. I don't feel any mass of the kidneys. And the last thing what we're gonna do is just palpate for the aortic pulse. So we go right to the right side of the umbilicus. Wait for a pulse, and then pull back, and then go back down again, about 1 to 2 centimeters over. Feel for it, and then again. And once we stop feeling, which is about here, we measure it, which is about 2 fingers, 2 centimeters, and that should be normal. If it's past that, that means we have an enlarged aortic. And that's it for my exam number 2. Thank you for your time.